It's 40 it's 4:02. My name is Ruth Schwendinger. I get to work with Prevention Network. And what we're doing with Prevention Network right now is working with Coalition Support Community Change Grant Program, which includes podcasts where I get to visit with some of the experts in our field about some of their favorite tools and just kind of ask questions about their understanding and how they approach prevention. We focus on substance misuse prevention at the community level and within the programs that I'm doing right now, specifically through coalitions and grassroots groups. But we understand that prevention happens on a huge range, on a huge spectrum of different levels and in different ways, and it affects us in different manners across the board. So Barry was kind enough to take some time to visit with me last month, and we recorded a podcast where we were able to kind of get a better understanding of what is the context of coalitions in our communities and what does that look like when we're talking about substance misuse prevention. So Barry Schmidt has been in the field for a little while now, and he's got a lot of experience, and along with a great personality and the ability to teach. Just a quick promo for our next guest, expert, Ricardo Bowden and Anna Winters joined me a couple of weeks ago to talk about building trust. And we're going to continue that conversation next month at next month's capacity building workshops. I encourage you to reach out to me with any questions you may have in advance for them about how do we reach those populations in our communities that have been underserved, that we have ostracized, that we have not treated with respect, that we have not come to with humility, that we don't have a foundation of trust with. And so Ricardo and Anna are working in Isabella County with different populations there, specifically with the Ojibwe people. And we had a great conversation in our podcast about how to build trust and how to overcome some of that bad history that we've had with mental health, with substance use treatment and prevention in the past. And as part of our public health group, that's one of those things that we need to address moving forward. And so that's what we're talking about next month. So it's 4:04, Barry. I feel like I've gone on long enough that people who've come in have had the opportunity to kind of adjust. Would you like to introduce yourself? And then if you would like to introduce yourself in the chat box, I'm going to open that up to you as well. Please include your name and email address. If you would like to introduce yourself in person, use the options in the chat box to just respond and give us a thumbs up or a smiley or raise your hand, something like that. If you would like to introduce yourself in person, that would be great. So.
Don't be shy, everybody. Don't be afraid. As Ruth said, I'm Barry Schmidt. I'm the coordinator for the Baycom Prevention Network, as well as the project director of the Neighborhood Resource Center. Yeah, I've been in the field about 30 years. I'm not an expert, so let's just take that off the table. I have a lot of good information, but feel free to introduce yourselves. I'd love to get to know everybody, and thank you for coming today. My hope is for this information to be very beneficial to you, and you can utilize it across the spectrum. Some of you already may be experts in some of these areas and not even know it, so feel free to introduce yourself. Anybody like to start us off? We got time.
I'll start. I'll go. Good afternoon, everyone. My name is Angela Wilson. I'm with All Wellbeing Services. Here at the agency, I am the prevention specialist.
Thank you, Angie. She's also a member of McCrud as well. So welcome, Angie.
Thank you.
My name's Danny. I'm a person in long-term recovery, and I'm with Peer 360 Recovery Alliance in Shiawassee County and part of the Shiawassee County Prevention Network.
Awesome, Danny. Thank you very much for being with us today. It's nice to have some peer recovery support services here as well. Great skills you can use with this as well. Others?
Hi, I'm Mary Jo Harris. I'm from the Family Center of Grosse Pointe and Harper Woods, and I'm a member of the McCRUD Group 2.
Yep, good to see you, Mary Jo.
Hi, everyone. My name is Georgia Jones. I am leading the McKinsey Noble Coalition, Drug Free Coalition here at DABA.
Welcome.
Hi, everyone. My name is Ayana Thomas. I'm sorry I'm not on camera. I am driving, but I am with Creating a Healthy Community in Wayne County.
Yeah, that's okay. We'd rather have you be safe and don't worry about it. You just want to listen, that's fine as well. Don't worry, no worries.
I'm Paige George with the Southline Community Coalition.
Welcome. Thank you for joining us, Paige.
Hi, I'm Lori Black. I am a student assistant specialist at Dakota High School in Macomb County, but I am here representing the Chippewa Valley Coalition for Youth and Families. And I did turn my camera off. You guys are all still really choppy. This is my home computer and it's supposed to be good, but Windows killed it. So, but I can hear everything okay. So.
Excellent. Thank you, Lori. Mobilizing Michigan. Great program. Thank you for providing that.
Awesome.
Anyone else? All right, well, I guess we'll get started then with the PowerPoint. Now you have to listen to me speak, so you had your chance. I'm just kidding. You can still talk the whole time. Feel free to ask any questions along the way. By show of hands, how many people were here last time? A few people, awesome. Yeah, Ruth's always here, so I like to see that. Thank you, appreciate that, everybody that was coming. Just to review really quick for those that weren't here last time, maybe with technology, you know how that works, right? Sometimes it doesn't work the way you want it to. Okay, let's go back, there we go. So last time we started talking about logic models. So I just want to kind of go quickly over this, and we'll talk about this. Hopefully, if anybody was here last time, you brought your logic model with you. If you started it, that's great. If you didn't finish it, that's okay. We'll work through it together. So when we're looking at logic model, think of a logic model as a picture of what your community looks like regarding an issue. And when we're determining the issue, we want to make sure that it's very specific, that we can observe that issue. That's identifiable. And this was all included in the handouts I did provided to Ruth as well, the link for that information. And it's actionable. And you need to know when we're actionable, you need to figure out where it's at, when it's at, and what the occasions are. Now, if you don't have the information, once again, that's information you can gather in the community assessment phase. So starting things off, I'm gonna move you all a little bit here. Here's kind of the crux of what a logic model looks like. You have a problem. So here is an example. Here is underage drinking. And after everything you have, whatever the problem is, you need to make sure you have two pieces of data for each of these elements. So for the problem, you need to have two pieces of data to prove that underage drinking is a problem. If it was underage marijuana use, or if it was opiate overdoses, you have to have two pieces of data to prove that there actually is that problem. Anybody ever been in a group where they say it's a problem and it's because they think it's a problem and they, but it really isn't a problem? Anybody ever been in one of those groups besides me? Okay, a few people, exactly. So you don't want to throw something on the wall and hope it sticks. We do that a lot sometimes in certain communities because they'll say, well, we need to bring that car crash in there because those kids are going to be scared. Well, we know the data doesn't support that. And where is the evidence and where is the data to show that that works? So that could be a component of it possibly, depending on your situation. Then you have to figure out what are the root causes. What is the actual risk factors that you want to address? Once again, you have to have two pieces of data. When you're looking at two pieces of data, it can be numbers or it be qualitative data, or it could be information. So it could be testimonials, focus groups, listening sessions. Those are just a few of the things that it could be when you're looking at determining whether or not. So in this situation here, they're looking at favorable attitudes. So they have perception of risk they looked at, parental disapproval, but all of those would actually have numbers by it, okay? There's one thing to have information about what you think the problem and why you think the problem is. So this is in the but why, okay? This is the stage. So we go the problem, we do the but why, which is basically the risk factor or the root causes. You having data to support each of those specific but why things you're doing. So you're gonna have data perception of risk, parental disapproval. That might be in something like in the MyFi, it could be in a survey you do, a youth risk behavior survey, any of those kind of different things you can get data from. And then the availability, that one might be looking at outlet density, that might be going out and actually asking questions to the neighborhoods, whatever that may be regarding that availability of alcohol, and looking at the MyFi as well. Then we move into that next phase. And that's about why here. This is your local condition. It's one thing to say that it's a rite of passage. It's another to say that kids are drinking at a high school game, or, you know, parents are hosting graduation parties with alcohol. Those are things that you specifically can see. They're observable, they're actionable, and they can be collected at multiple times if needed to prove that there actually is that concern. All right, I'm going to stop there and see if there's any questions on those three pieces. Problem, but why, and why here. Any comments as well? Feel free to unmute yourself, and I'll check the chat box as well to see anything as well. All right, so that's just kind of a review of some of the things we talked about. We're going to go through a little bit more here as we continue moving in the process. When we're developing a logic model, and we'll go through this again, you heard me say it again, but when you're critiquing a logic model, you have to ask, is data included in the problem, root causes, and local conditions? If you don't have data to support it, it's not really a logic model. It's something that is a model, but it may not have some logic to it. Hopefully that makes sense. Okay. You can have all sorts of ideas, but you have nothing to support it from. Number one, funders are less likely to support it. Number two, your community is less likely to listen to you because you think that's a problem. And they're like, no, that's not a problem. How can you prove that that's a problem? Okay. You need to make sure you have local conditions. You can't just say, I remember years ago, one of my colleagues said, well, alcohol is a rite of passage here. And I'm like, okay, but as you move into logic model, you have to actually prove that that's a rite of passage here. We can go back in ours and say, okay, we have a lumbering history. So we know that. We can go back to Hell's Half Mile as an example. We can look at the historical part of it. This is all part of your community assessment. We can look at how many bars per capita we have. We can look at how many parents are providing alcohol during graduation parties. And those are all specific, they're all identifiable, and they're all actionable. And then you have to make sure you can read it from right to left and then backwards to forward as well. Okay. And it has to reflect your community conditions and your concerns. I think it's CADCA that says that local problems, local solutions. I think that's so imperative when you're doing this. Is a lot of times you might have somebody that is maybe in your coalition or in your community that think, yeah, that's the best thing we should do. It's working everywhere else. Anybody ever been in a situation where everybody thinks it's the greatest idea, but really might not be the best fit for your community? Anybody besides me have that happen? Yeah, raise your hand or put your hand up on the, exactly. It's important to realize that because local conditions is where everything kind of occurs. So here it goes again. I'm going to keep going to this because I want to make sure you got this, because I actually want to walk through one. Problem statement. Here's the data they have for here. Data number 1 point here. They have 30-day use. This is from a survey they did, as well as MIP police data. That survey for you might be the MyFi stat data, and it might be the police citation data. But it may not be the police citation data, because I don't know about you, we don't get very many MIPs anymore because of the MIP law change. So maybe it's getting information about number of suspensions regarding alcohol in the school, because not every school always reports it to the police. Anybody have schools that do that don't necessarily report anything to the police? Okay, that's an example of what we're talking about. And then you have to look at the root cause. And they usually want you to do 2 root causes when we're looking at this. The reason we only focus on 2 is, number 1, your coalition, if it's focusing on more than 2 root causes, it can become very bogged down, because you'll see as we continue moving forward, if we have an opportunity, we'll talk about intervention mapping a little bit as well. So once you have the root causes, you have the data to prove that with the local condition. Yes, I know I'm repeating myself, but I'm doing it for a reason. I want you to make sure you understand this and get that as an imperative piece. So, did anybody do a logic model? Did anybody start one? If you did, I'm going to stop sharing, and I'd love, Ruth, can we allow them to share? Is that possible? Is that okay? I'd love for you to share your own logic model, and don't worry if it's not done completely. We can help you with it today. Did anybody have an opportunity to do one? Everybody was scared to do one. No. Anybody have a logic model they'd like to share that they might have, that they've done?
So Barry, in my reminder email, I encourage people to make sure they had an issue. So we might just start from scratch. I did
All right.
drop that blank worksheet in the chat box. If people want to start developing their own logic models, you can use that, and we can work on building one together maybe. I know we were doing this because a lot of people in previous workshops were saying logic models are just a bit scary. And so we want to get people comfortable working with them and comfortable with using them, because they're a fantastic tool for an at a glance look at what are we trying to accomplish as a coalition and how are we going to get there.
If nobody has them, we can work on one in real time, because I actually have the, come on, you let me talk right into it? Yeah, not gonna let me do that.
I have a draft if anyone wants, if we could pick
Yeah,
on it real
please.
quick.
Here, let me stop and you can put yours up. I love it. Thank you.
Will
Love to see
you pick on it for me, Barry? That'd be great.
Of course, we'll pick on it as a group. We're gonna work together. That's why we're doing this. Go ahead and share anytime you have sharing capability. Awesome. All right. So let's take a look at that. So we see what his problem is. Okay. So first and foremost, can everybody see that okay? I don't know if can you enlarge that a little bit?
Yeah, thank you.
Because I'm visually challenged. I don't know if everybody else is, but I'm visually challenged.
I am too. It just got little again.
Yeah, can you make it larger one more time, please, sir? Thank you. Don't worry, we can always move it. You can always move it around if you need to.
No problem.
And
Let me
this is
know.
awesome. Wow.
So yeah, this is for Genesee County, something I've been putting together, and we use the MyFi data, and then we have our community norms data that we used for it. So I took from the 2 sources, and kind of similar to what you said, but like we found favorable use towards alcohol. I found, 30% of students reported that if they had the opportunity to try alcohol, they would, comparatively to some of the other drugs like marijuana, prescription drugs, or
Okay.
opioids. 75% almost for 9th and 11th grade students reported their friends felt having 1 or 2 drinks nearly every day to be wrong or very wrong, comparatively to some of the other ones. And, social access, availability of alcohol. We originally had retail access as well as, in homes, but we kind of split that up together, or we grouped them together. So we had consume alcohol in their own home and then consume alcohol in another person's home as some of the local conditions that we had. So.
Okay. Looking good. So if we go, so we're looking through it, we see the problem. We see you have the two root causes. You do have data to support each of those. Did you do, besides the data you did with numbers, did you do any other investigation of anything else regarding that?
Not so much, like I would have loved to had some good surveys, or I mean, I guess I should say some data from community groups that we could have used and implemented in this, but I couldn't find anything that we had previously. So I've only been in this coalition for going on 2 months now. So this is some of the data that I was able to pull and able to create this logic model.
Wow, I'm impressed. Very nicely done. Yeah, because one of the things you want to try to do is have not just quantitative, you want to have some qualitative data too, if you can.
Right.
And it's not that you did a bad job here, it's great, but qualitative will also give us kind of another layer. Especially the root causes, you're right on task with that. But if we move over to, I'm just kind of looking at it, the local conditions, increased social acceptance among youth. So half or more believe. So you might even find out why they believe that. That might be part of that as well. You could ask those questions. You know, because you said students think that half or more of the students think think that half or more. Why do they, you know, could ask the question, why do they believe that?
Right.
You know, you could do that in a listening session, where you basically are just listening what they have to say. You can do a focus group, which you got to make sure you follow the protocols regarding your organization for focus groups. And if you have one of the grants from Prevention Network, make sure you're following those federal guidelines regarding focus groups. An IRB, Institutional Review Board. I don't like those very well. No, I like them, but they're just a little different to deal with. But
So
yeah,
Barry, I got clarification on that point, that if we are gathering information from people in order to improve service, it doesn't
Yeah.
require an IRB.
you all should be clapping right now because IRBs are a nightmare to deal with. So they just have so many different things you have to do regarding those things. Okay, so increased social acceptance of alcohol among youth. Yep.
Yeah, right. So like I think that's the only thing that is missing is kind of that you know, that qualitative data that we could use, get some more perception to be able to back these
Right.
points. It's all data right now, you know, that's kind of what I've been,
Right.
the data that jumped at me at the page that kind of was coinciding with a lot of the, you know, the root causes that we had. So that's exactly what it kind of felt like I was doing, is building the
mean,
story
you're-
out for it.
Yeah, your data is really good. Can you go back up a little bit to that social access one? I'm just reading. Students think that half of the students. So those are two similar type questions. That's the only reason I say that. Because think half or more of the students in the grade drank alcohol, where report thought some of their friends is very similar.
Mhm.
So that's why I would try to get maybe something else in there. That way there's something else to support that besides just their thoughts. That makes sense.
Right.
Okay.
Yeah, because it kind of started here with 30% of students reported that they would,
Right.
if they had the opportunity to try the alcohol, and that's where the disparity was between alcohol comparatively to marijuana, prescription drug, opioids. I'm like, okay, so if they have that favorable attitude towards that, now I gotta break it down to some more and sell some more. Obviously, there was, you know, a bigger number of students thought that half or more of their other students in their grades were, you know, have been drunk or have drank alcohol recently. So
a couple different ways you could break this down would be look at the actual grade. You could take a grade, if you're using the MyFi 9th or 11th. You could also look at the race or ethnicity, as well as you could look at grades. That would even be more specific. That would be one thing you could do to even laser focus it even more. You know what I mean? So you'd have exactly the population you're dealing with that specifically, and regarding the social acceptance, especially you could say that maybe not like for ours, it would be Ninth graders for ours would be an example, or 11th graders, or it could be a black, it could be white, it could be Hispanic. You know where I'm going with this?
Right. So like these two different percentages are obviously ninth grade and 11th grade. So I mean, at least
Right.
11th grade of high school students reported that some of their friends had been drunk recently. You
Yep.
know, is a much more staggering. About 50% of high school students or 11th grade students thought, yeah, I get that.
So anybody else, any thoughts on anything you've seen so far? Any comments?
Oh, Angela had a question in the chat box.
Oh,
We might
please.
need some clarification on that. Angela, do you ask the questions in the logic model?
Yes. So what I was asking was, when you mentioned, Barry, that he might want to ask the question. So my question was, is that a question when you're creating the logic model, you ask yourself to create the logic model, or you insert the question in the logic model?
That's a question you'd ask yourself as you're
Okay.
creating a logic model.
Okay.
Because when you're looking at, so when you get, like he has his data here, you want to see, are there any gaps that I'm missing? How can I get it to the point where I'm laser focused? Because a lot of times we will say we want to target high school students. Well, if you target all high school students, you may be missing some. So here's an example. There's a colleague of mine that would do an analogy that you're going to have two young people that are going to say, I'm not using drugs and alcohol no matter what. You're going to have another two that are, another two, they're going to say, well, I don't want to use it because it's just something I'm not going to be involved in. But you have those other six, and those other six are the ones you really want to make the most impact on. Does that make sense to everybody?
Yes.
So that's why we ask those questions, to make sure that we're being laser focused. And when you're laser focused, it's easier to do two things. Number one, get your community on board, which means resources, capacity building, which means as well, maybe your funding might be more streamlined that way, and you're more likely to have better results. Because if you're just saying, I want to target all high schools age group, and you might, so I want to ask, I think it was Anthony. Oh, Anthony, how many people are in your high school?
I think this particular data set, especially for the MiFi data, ended up pulling from, I believe it was like 12,000 students.
Yeah, that's kind of hard
Or
to focus on.
1,200, sorry, 1,200, sorry, for this data set.
Well, 12,000 is even bad, but
Yeah,
1,200
right.
is even a little challenging, and because 1,200, there's probably some they're going to say take flying leap no matter what you do, right?
Mhm.
And there are others that will say, I'm never going to do that, so I'm going to support whatever you're doing. So that's why it's important to have an idea of laser focusing that. So that was great there. Yeah, I know, Mary Jo. I don't have it this year. I got 2 districts that did it out of 4, so I get it. The one thing that I encourage you, if you haven't done, is work with your school health coordinator from the ISD, and just really hammer with them and tell them that it's important, because I believe there's money they get from, each school gets from the feds, that they have to have a school improvement plan. So that might be a way to get them to in the next cycle, because I know this cycle is just about over with. So and we've even offered, Mary Jo, ourselves here, we'll even do it for you, which I'm sure you have. And we said, we'll even analyze your data for free for you and tell you exactly what you need to do to improve. So yeah, those are different things. Yeah. Another way would as well, that I've done, and it's a back door, is I'm at our ISD, our career center, and I actually just had the students create the survey. And then I just put them on QR codes and put them all over the building. And it's anonymous then, so you kind of bypass that end of it. So that might be another way to gather some information. It's a back doorway. You have to get permission from the school somewhat, but they're like, well, we're not collecting it. You don't have any names or anything. So, that goes back to relationship with the school there. So sorry I can't be more help than that, but I know everybody's focusing on that MiFi this year. Everybody's having a hard time with it. So yeah, completely agree with that. Let me double check to see if there's any more chat box ones. Okay. All right. So then we move down to lack of parental insight towards alcohol use. Talk to them about alcohol use. You got some good data points once again. So the 2020 community norms, can you tell us a little bit more about that? Is that a community survey you do then?
Yes, I think that's something they put together last year. It was fairly in-depth,
Okay.
kind of expanded on a lot of these questions that we had presented. It's through our evaluation team.
Okay.
They
Awesome.
put those together.
You've done really well on here.
I have to go to CADCA next week to go present it, so I hope it's okay.
Well, it looks good to me. And Dorothy trained me, so Dorothy Cheney trained me. So
Oh, excellent, excellent.
yeah, and then lack of parental insight towards alcohol use. Tell me what you mean by parental insight.
Well, it was kind of, we're still kind of going through it tomorrow. We'll put the finishing touches on it, but I'm trying to figure out how to word that, because I know that I've had, the data was popping out to me in a sense that this was the local condition I wanted. We really wanted to hammer it at home, because I was finding it consuming alcohol in their own home, and then kind of the perception towards it as well. So I was finding, parents didn't want their children to drink, or they didn't want their children to drink, but students were reporting that they may not have had the talk with their parents in doing so. And then I also found that like 14% of parents only keep their alcohol locked up. And, I was just finding a lot of data points that were kind of telling me the story about what I wanted to put into it. But tomorrow we'll be able to refine these points a little bit more to kind of get a better sense of which direction we really want to go with it.
As I look at those 3 points, I see 2 communication ones and one that really doesn't fit into communication.
Right.
Because I see the one that says reported parents have talked to them, that's communication. High school students, parents, other adults in their family have talked with them about what they expected, that's communication. And then stated what their child wouldn't try alcohol. I don't think that's related to that necessarily, those 2 points.
Mm-hmm.
That third point doesn't really mesh with that one, in my opinion.
Right. It's like it was kind of, the way I took it was like it was a parental perception of what they would think for their child. If it's kind of like
yeah, I agree with you, but
Yeah,
I'm
yeah.
saying it doesn't really relate to, I think you're saying the first 2 look at communication,
Mhm.
talk to them, and ever talk to them. And then the third one doesn't really talk about talking to them. It talks about whether or not they actually try. So
Right.
what I'm saying is it doesn't fit into that specific local condition. Does that make sense or not?
No, it absolutely does. Yeah, because it was something that I've kept the 2 data points for everything, and then I added this one on because I may have looked at too much data, Barry. So it just kind of seemed like it flowed for the moment.
And I believe in the MyFi survey, there is one question asking about how often, if they have talked to them too.
Right.
Their parents have talked about what they expected them to do, or not to. Okay. So that would be the only thing to critique that I would have personally would be looking at the 61.8%. Just doesn't really fit. But you can talk it over with your team. But that's just my opinion. It doesn't fit. Well, you're not to erase it. I'm just giving you my opinion.
No, that was the only data point that was kind of, it was the only thing that was iffy to me about this. Did it make sense there? Probably not.
All right. So Danny, lack of personal awareness, youth consumption. Can you, so you're on the next one then? Is that what you're looking at? Go ahead and unmute yourself and give me an idea what you're saying so I can get on the same page as you, please.
He just said he was looking
Oh, you think
for
it should go down there?
up where we were just at.
So she's saying lack of parental awareness.
Instead of insight.
Right.
And I'm sorry, I'm really floored by that
Yeah,
third
but
one you took out. Like 61% of parents are, I just find that hard to believe that.
That's where I would put.
That's scary.
I would put that action under maybe youth access consume alcohol in their home because parents don't think they're going to end up using it.
Yeah,
At one point you just said under youth access, consume alcohol, that's where I would put that data point, because to me, that actually supports that end of it compared to the other part.
hmm
So that would be our, and Linda from up north agrees with me, and the people from up north are smarter than I am, so, because they're really good up there. All right, so. Hey, you got to work. I'm happy. Good. Yeah, because it makes more sense there, because they're saying youth alcohol. Well, I'm not worried about my kids not going to try it. Why do I need to worry about it in my home?
right.
That's why it kind of fit in there. And then can you scroll down a little bit more, please, sir? Thank you.
Do you need me
So I'm
zoom
going to
in at
stop.
all?
Yep.
okay?
Anybody else, any other comments on it? All right, so let's walk through youth access, consume alcohol in their home. Data youth who drink, good, I like that. Kept alcohol locked up. Danny said great logic model, by the way.
Thank you, Danny.
By the way, everybody, I would say, can we have a copy of this so we can borrow it and steal it, right? We're prevention. We beg, borrow, and steal and give you credit when we need to. All right, so social access, graders report, easy to get. For that, if they want to show alcohol their home, their friend's home, be easy to get. Okay. Parents reporting their child wanting alcohol, they could receive it from a friend. Okay, I think that looks pretty good too. I'm not seeing anything major that I'm seeing there. I'll open up to the group, either chat box or comment, anything you want. Feel free to unmute yourself if you have a question, anything like that. If not, I think we can give Anthony a round of applause for a great job. Yay! All right, so we got a question here. So be specific in data. Yes, the more specific you are, the easier it is to make sure that what your logic model is showing forwards and backwards can fit. If you're not specific in your data, then you're just saying it and not proving it. Remember, a logic model is an evidence-based tool we're utilizing. Does that make sense? Okay. All right. Thank you, Sarah. Anybody else regarding that? So any other problems that somebody has that we want to walk through a logic model, we can walk through another one if you want. We do have some time. Or I could continue on going and move along in a little bit about intervention mapping, if that's all right with you, Ruth, as well. What's the group like to do? This is your presentation. You tell me what you want us to do. Give me a chat box. Tell me where you'd like me to go with this. And I think he had some strategies too. So we won't
Do you want to talk about what to do with a logic model, or do you want to look at another logic model and information?
That's up to them. What's the group want to do? I'm okay with either one. Do you want to work through another logic model? Kind of walk through
Marcel?
each. Marcel said, here we get it here. Local condition of a logic model. A local condition, are you talking about, the local condition would be, can you put your back up, Anthony, for us, please?
Sure, no problem.
And I know that Kelly has a question. One second, Kelly, let me get to Marcel. Marcel, are you talking about the logic model itself? Or are you talking about what local conditions are? Or can you give me a little more insight on that? can either chat it or you can unmute yourself, whatever's
So
easier.
Marcel let us know that his microphone's not working tonight. So
Okay. So what you're saying is when we have the local.
Because I'm on my other one.
So what we're gonna do is you're asking us to look at a local condition and actually run through how it would look based upon some strategies, correct? Yes, I can do that, but and hold on a second, because I'm gonna give you some ideas how to do that in 1 minute. Perfect segue. Kelly, you had a question or comment?
Am I muted? Oh, sorry. My question is really related to what you were just talking about with Marcel. Last time I mentioned the issue of the beer tents that always go up at our festivals, and one of them is held at a local park. So since then, I've been doing a little bit of local research of these festivals and these beer tents, and when they go up, when they open up, what kind of activities are associated with them. And it's kind of oblique to me. So my opinion is this is a problem because we're associating drinking with recreational activities for adults rather than having them be sober activities. Like, for example, having them associated with a festival and opening up at noon. Having them associated with the festival and then adding some sports like volleyball or whatever to it, and beginning to serve alcohol in the middle of the afternoon in the middle of downtown. And then, so to me, what I'm seeing is we don't have enough sober activities or activities that include youth. And the youth are seeing, well, there's all these cutesy things for little kids. And then the adults, well, they just drink. They drink when they fish, they drink when they hunt, they drink, when they're playing volleyball or cornhole. That's what I was trying to think about. Or the mug holding contest. So,
Right.
So how would you build a logic model around that?
Yeah. And first of all, your root cause, well, you'd have to get your underage drinking. It's a problem in your community, I'm assuming. You have data to prove that. We'll just make an assumption of that at the moment.
Okay.
The next thing you're gonna do is your root cause. Your root cause would be community norms. So your special condition is maybe the number of festivals that have alcohol at it compared to those that are sober friendly. And you could have data to prove that based on your local research you did as well. Okay. And then when you're looking at that, you could look at it with the community norms and that as well. Is there any problems with the festivals as well? Maybe another thing might be you have more drinking and driving accidents or something like that.
Right.
So those are all part of the specific local conditions, but in turn, it also could be the problem. So that's where you got to kind of go back and find out what actually is a problem, because the drinking at the festival may not be the problem. It may be a symptom of the problem. If that makes sense or not.
Yeah.
So in Bay County, as an example, we have more festivals that have alcohol in it probably than most festivals of our size city. Okay. There's only maybe 2 or 3 festivals that we have that don't have alcohol as the centerpiece. So one of the things we did was the local condition is we had more festivals. We got the data to prove it. So let me go into the strategies, because that's what you're looking for. But I think you have to first figure out what is the actual problem, what is the actual root cause, and then have to get to that root cause once you've identified that local condition. So let's start that local condition. Amy, go ahead. You have a question.
Thank you. So I was just going to mention something that we did in Ingham County that was related to this. And actually, I like your idea. And I think the social environment is going to be the long-term goal.
Mhm.
What we actually did was we thought in Ingham County about what we could control. And
Mhm.
so we knew that environmental health required festivals to pull a permit when they were serving alcohol.
Mhm.
And then we offered the festival to train their alcohol servers that were volunteers. And guess what? All the liability rests with the individual volunteer when you look at the laws in the state. And guess who didn't want to volunteer anymore at serving alcohol? And so guess what happened? That easy, cheap way of making money slowly dwindled away because people learned the truth, because that's how we bait and switch, right? We put all the responsibility on the individual. But look what that did. It changed the environment. And we had one Catholic beer tent that had pictures. I mean, pictures are old news. Nobody does pictures anymore. You can't control who's drinking out of it. But this church had done pictures of beer for what, 35 years. And when we told them they were the only beer tent with pictures, they stopped. So just gather more data and think about what you can control.
Yeah, one of the things that we did is we offered the training and they said no, because we have Fabiano Brothers, which is our distributor. They provide the training to the actual beer the volunteers that serve. What I can tell you is I went to their training and it was laughable. That's all I'll say. But they had a training, so they could say they had a training. So if there was those issues, so that's the other side of it. One of the things that we did here in Bay County is we actually provided all of our festivals with ID scanners, where we provided that as an opportunity. And we've done that for years. And as well, we've had underage drinking, not a minor problem, as our campaign we've had for years. We actually had our signs at almost every festival that had alcohol on it. We had that as well. We connected with the security teams, and they actually were the ones that facilitated all those things. So that's why you got to know what the problem is and know what the root causes are. And we knew that security allowing alcohol was maybe one of the local conditions we had to deal with, or the festivals allowing free flowing of alcohol and not having much accountability. So if you have that issue going on, you work with those different organizations. So hopefully that starts to get in there. Now we're starting to get into the strategy side. And I completely understand everybody wants to jump to strategy side. I always do too, but let me just tell you from experience, if you don't look at the problem, if you don't look at the root cause, and if you don't specify the local conditions, you're going to have a short-term change that doesn't last. I'll say that again. You're going to have a short-term change that doesn't last. Okay? Because there will be other competing things that will take your attention, and you think that, oh, that's done. Reality is it isn't done. Underage drinking as an example. So I'll give you an example. We dropped underage drinking in Bay County almost 45% in a 10-year period. Okay? Phenomenal. We did a great job with that. There were a lot of things that were happening, a lot of different organizations, a lot of entities. But then this thing, opioids, came up, and everybody's like, oh, what do you do with opioids? And we got caught up in that issue. And then underage drinking didn't have the amount of priorities it had in the past. Guess what? We're now #1 for underage drinking again in the state, according to last MyFi survey, because we didn't look at the problem. We looked at what everybody thought the problem was. So I'm cautioning you to make sure that you're figuring out the problem, you're figuring out the root causes are and the local conditions, or you'll get caught in that trap that basically, if you think it's a problem, it's a problem. And I don't know about you, we have all sorts of organizations. Oh, we got this problem, let's do a coalition. Oh, we got a problem, let's do this group. The problem is a lot of times those last for a short period of time and they fizzle out. So as an example, this opioid issue in 2015, the health department jumped on it like, oh yeah, we had 65 people on that. 5 years later, everybody's disbanded except for the prevention group, the only people that are doing something still. The point I'm making here is that we looked at the problem, we looked at the root causes, we looked at the local condition. They did, and they said, we need this, this, and this. And when you say you want to do this, this, and this, and you don't have the problem, the local condition, root causes, and all that kind of figured out, it just makes it easier to get caught in quote unquote the weeds, although it makes sense or not. Okay, so I'm just cautioning you how easy it is to get caught up in the trap of trying to do something to do something. And I'm on the family executive narcotics, and they're always wanting to do something, do something. And I said, no, you can't do something to do something. You need to prove you need to do something to do something. So that's an example. Thank you. If you can stop sharing, Antonio, would be greatly appreciated. Anthony, I'm sorry, called you the wrong name. My bad. All right, so let me go back to sharing my screen because I actually want to walk you through okay, technology, go away. I'm going to move you guys over here for a second so I can actually get rid of that. All right. Yes, leave it. Logic model. All right. So you can see my logic model thing again, blah, blah, blah. All right. So I told you that. Here's the logic model from the get-go, just to get it started, just your different pieces of it. Anthony did a phenomenal job, so I don't need to go any more detailed than this, but these are just an examples of different things that we talked about when I talked about getting qualitative data, observational data. The other thing you could do, Anthony, too, would be do environmental scans and see what's going on with that as well. Informant interviews are another piece as well, and focus groups we mentioned as well. So your logic model, Stephen gave you a smiley face, so I was ready to see him. All right, so we did go through that. So let me talk about strategies. CADCA has what are called 7 strategies. These are 7 strategies for change, and there's providing skill information, there's building knowledge, there's changing attitudes, developing skills. Those are all individual strategies. Those are the ones everybody wants to do, and those are important. But they do not have the impact. And those are probably your 1 month to 6 month kind of thing you want to do. But when you're looking at long-term change, you want to look at changing the consequences, changing the physical environment, modifying and changing policies. Modifying and changing policies is very difficult. Anybody that's been on the alcohol policy group knows how hard policies are to change and understands what that entails. That's a long-term goal. And you may provide information, build knowledge, and change attitudes, develop skills along the way to actually do all those environmental things as well. So they're sometimes interdependently connected to each other across that spectrum. All right. So one thing I want to caution of you when you're doing intervention mapping, so we're going to be talking about, is what I have on the screen here. One problem at a time. Underage drinking, that's your problem, that's your problem. Only do one risk factor or at a time, or root cause, depending on how you determine to call it. One local condition at a time. And make sure you're choosing as many activities that you can that are going to fit your capacity, skills, and community regarding those things that we just talked about. In those 6, 7 things I gave you, that's a 6 to 24 month process. Okay. And some of those may be longer than 24 months, but you're going to make progress on those 24 months. One of the things that I don't have on here today is what I've been doing now with ours is I've actually made a chart of looking at each local condition and seeing what we've been doing along the way and tracking that. So we have a monthly tracking of what we're doing, whether it's information, whether it's interviews, whether it's gathering information, whether it's doing a program, whether it's collaborating with somebody new. You know, one of the things that we got was to do some things with the African-American community. So local condition is to build, for us, is to build that capacity. So we are going to be doing a event at the Juneteenth that they have on. So that's an example of something that I'm looking at that relates to all of our logic model processes when we're looking at building capacity. So these are some examples of what they look like. And these are from CADCA. You can get these, they're free. They're on a website, and I'll make them larger because I'm visually challenged as well. So don't worry, we'll get it bigger for you. All right, so taking a look at one here, intervention map, this is kind of how it breaks it down. This is for impaired driving. This is an example of impaired driving one, okay? Notice there's only one problem here. Young adults, the root cause, availability of alcohol. So it's about access, okay? Now you can even more specify that and say social availability or retail availability, depending on how detailed your logic map, your model was, which I love what Anthony did with his. And then you can look at, there's different strategies, providing information. Here's some examples of what you can do. And once again, this is from CADCA. These are the experts. These are the people that do this for a living, that know what works, and based upon other people throughout the whole United States. So use this, and this is all on their stuff, by the way. Creating an issue brief, providing information to licensed establishments. Okay. Anybody do vendor ed? You do it for alcohol, you might do it for tobacco. You know, this is an example we're talking about. Also doing some media campaign stuff. All right. Once again, if you do a media campaign and you have it through this grant, you got to make sure that you're getting approval through the state. So make sure you're connecting with Ruth on that as well. Building some skills. I want to make sure you understand this is not in a bubble. Don't just do one. You need to do multiple levels. If you do one, you're not going to see the impact, because all of these things you're going to do are going to build on each other. Okay. Do provide training. And I heard Amy, I believe Amy said that they did some training for their servers of that. Excellent. Okay. Maybe it's also, I know that Emily Rose Finkel was on the meeting the other day, and at their festival, they're actually going to have a sign. It could be providing information as well as building skills that actually says, here's what a standard drink is: a 12-ounce can of beer, a shot of whiskey, a 5-ounce glass of wine. Actually has a display showing that, so people get an idea of what that looks like regarding that. Providing support. Sometimes it's providing money, sometimes it's providing tools across that spectrum. And that might not just be law enforcement, it could also be the festival, or it could even be the bar or the retail establishment as well. I'm going to check and see. Thank you, Ruth, for throwing that in there. Excellent. And then we're looking at the access and barriers once again. Looking at what can you do to limit the access and what barriers can you create to do that. One of the things, I think it was Emily Rose again that did, and some people have done, I know I've talked to Kelly about this, is tamper resistant tape. So if you have alcohol in your home, you can get tamper resistant tape. It's pretty cheap, put it on there. That way they would be able to know whether or not a young person's gone in there, because once you break that tape seal, you'll know it's broken. That's an example of a barrier. If you're looking at opioids or marijuana, maybe it's having lock boxes. You know, that's another barrier in access. Or it may be the other end of it. Maybe it's the peer side. Maybe it's providing more access for people that are dealing with the substance issues, such as Peer 360 Recovery Alliance providing peer recovery coaches. So that's an access you can provide. So it doesn't always have to be the negative. It can also be the positive as well. Remember, you have risk and protective factors along the side that you can use as well. Then you move on to incentives and disincentives. Does anybody that does vendor checks or compliance checks do certificates or anything like that? I know we do. Anybody else? I'll look for some hands. If I can. All right. Excellent. Thank you, Grace. And thank you, Danny. Yeah, exactly. It gives an idea of whether they sold or not sold. If you can get the chief to sign it of the police and your coalition president or coordinator, that is even a plus. And if you get your mayor to sign it, that's even better yet. That's what we did here. We had the mayor sign it and our chief of police, and provided a letter explaining the information as well as a certificate that they can display. I know some people up north, or maybe it's Troy, I think, that does a sticker as well. They can, and they have a year on it usually that they can put up as well. Some people do those regarding those. So when you're looking at access and barriers as well, that could be something as simple as doing a sticker shock program as well. Physical design. How can you design the physical? Think of a festival. So let me ask anybody, what are some physical barriers that you could end up having regarding blocking access to alcohol? What might be some examples, physical design issues? Let me ask anybody has any insights on that.
Can you repeat what you're looking for with that?
Yeah.
I guess that's exactly what I'm looking for, examples. So never mind.
Yeah. So let's say I'm having a festival and I want to make sure that alcohol is staying in a certain area. What are some things we do to make sure that happens?
Fencing.
Fencing, but not just fencing, double fencing. Okay, so you have a barrier in between, double fencing, okay? You might even talk to the facility, physical design, what about cup size? Okay, you ever been to a Tiger game? Right? 3 beers in 1 glass, right? What if instead we said, okay, what if you make sure they understand that there's a certain cup size you want them to use? That's a physical design change. Okay. When you're looking at parks, maybe it's a needle spot where they find needles, they can put it in a needle dispense, a needle, what do you call those things? Disposal thing.
A sharp.
Yeah, sharps container. Thank you. Exactly. One of the initiatives we're going to start next year is something called Clean Park, Safe Park. And we're doing it to the point where an individual told us about this, and we've looked at our parks and like, we need to do something about it. He said when he was 7 years old, he saw a cigarette on the ground, picked it up and wanted to smoke it. We would not want that. So it's about picking cigarette butts up. It's about getting rid of needles that we see, and for us it'd be calling our dispatch to have them come get them. But you also can use like a tweezers, and put them in a little plastic container, wrap them up. There's processes in that. I can give you a video on that from another state that's done that, as well as alcohol bottles all over the place. So we're looking at instituting a clean park, safe park, and we already have our city parks department and county parks department that are on board to do it with us, whatever we can do to support you. So maybe it's lighting. Maybe the lighting's an issue as well of that. I don't know if you have any baseball or softball, but we have baseball and softball in a couple of our parks. And what do after the game? They all pull out the beer. So maybe that's about enforcement there. Maybe it's changing the hours. Maybe it's, whatever that may be, because there are young people there as well. Maybe it's designating an area. Those are all things, physical design things you can do to change what is actually going on. Or if you're looking from a standpoint of marketing, maybe it's a policy type thing that's a physical design as well. That example, marijuana. We don't want marijuana saying different signs about advertising with cartoon characters as an example. So those are physical design type things. And then move on to what are called policy or regulations. And that's where the rubber meets the road. That's where you're advocating. I'll say that again. That's where you're advocating. There's a fine line between advocating and lobbying. And I know that's something that you can go back and listen to Mike Tobias's little presentation on that as well. I encourage you to do that. And I know that he's doing some research right now on that with CADCA talking about that issue as well. And I'm sure he'll be able to update as that moves forward with his organization. So I don't know if you have anything to add, Ruth, because I know you had unmuted yourself regarding that.
Yeah, when I first started, I felt intimidated by trying to change policies and regulations. I thought there's no way. Maybe I can go in and talk to a police chief, but I'm not going to go in and change a law. That's way beyond me. But what I've learned over the last few years is that the vast majority of regulation in Michigan is left up to local governance. And local ordinance can really make a huge difference, especially as we were going through the legalization of marijuana and for various uses, and looking at that, and had people from all over the, the eastern part of the state calling and asking, what should we do? What should we do? And, I reached out to Barry and Mike and others and said, what are others doing? And that's the power of prevention, is we can check with other people around the state. We can check with people from different states and see what they're doing as well, and then make recommendations based on that. So don't feel like I did that this is out of reach, because it's not. So I just wanted to encourage people with that.
So let me even add to that. When you're looking at policy, there's big P, that's government. Okay, that's probably the hardest one to change. There's also little p. Think about your organization. Look at your policies and procedure regarding your organization, regarding alcohol and other substances and how they're handled, or maybe what happens when somebody ends up having an issue with it. What are your policies and procedure regarding that? You can take a look at that. What about your local Chamber of Commerce's policies, or your local businesses? What are their policies regarding that? Or your local hospital? Those are little P's that sometimes you might have an easier time changing. Or how about your school board? What are the school policies? As an example, here's a quick story. One of our schools has a policy. This is going to blow your mind, blew my mind when I heard it. You get caught with marijuana, it's a 45-day suspension. Okay, you just gave them 45 days to go home and smoke marijuana. Well, what is interesting is that that policy is going to change now, because one of the board members of that district, their son got caught. And they're like, what, 45 days? That's not fair. So, sometimes, unfortunately, that's a blessing in disguise. But the point I'm making here is that you don't know what's going to happen. So narcan in schools is another issue a lot of people are having with regarding policies. So we're working with our schools to do that. And you never know what can happen there with all the counterfeit pills and that going on right now. One district I went into, explained the situation to them, and I had established a relationship with them already. So let me start that first and foremost. Start building relationships now. Don't go asking for things until you build that relationship. Otherwise, they're going to think you're just there to get something from them. And they're not going to be your friend. They're going to be your frenemy. If you get what I mean there. Not necessarily your enemy, but they will give you so many barriers that you will not be able to get through those. What I have found in my years of work is I offer everything and anything I can, even if I have to sacrifice something else to make sure they're going to get what they need to help them to be effective, because when that happens, they open the doors for you. So this school district I went to, I've been working with for about 5 years now, and built some relationship with them. And I told them all the things we can provide for them. They said, well, if we get somebody caught, what's the turnaround? So we can do it in a week. She looked at me like I was crazy. I'm like, yeah, I can do it within a week. We can do that. So in that conversation, I said, well, now we got this Narcan thing, and here's why it's important. They said, all right, how many doses can you give us? I gave them a box of 12 when I left out the door. No, they may not have the problem, but if they end up having somebody overdoses, whether it's a staff or a student, they are prepared now. So by building that relationship, a policy change happened. And that's a win. And that's a short term there, but you never know what more policy might change. So when I say policy, don't just think big P, government, because that is the hardest one to change. Think of your local policy as well. And local may not just be government, but it can also be school, like I said, businesses, etc., across the spectrum. Has anybody had any experience in changing any policy, or in a positive or negative way that I'd like to share? Because we're just about out of time. Is there anybody who'd like to attempt to change a policy and you're kind of scared? Amy, go ahead. I like policy change.
I'm from the old days, and so I've worked in local public, I worked in local public health for 30 years. And so all of the smoke-free air laws, that's what I worked on when I was younger. That smoke-free restaurants, smoke-free bars, we never thought it would happen. And it did. It took a long time and it was incremental. We had to start at the beginning, but I love it.
So I want to make sure you heard what she said. It's a long process, but there are incremental things along the way that you can do. You may not get everything you want right away. You only
And
get,
it's all about relationships, Barry. It's all about relationships.
Exactly.
You've got somebody whose mother can't go out to eat and they're powerful. Guess what? Somebody's listening. It's always about something personal.
exactly. Use those testimonies and use that information. Anybody want to share any other experiences regarding that? So Marcel, did I answer your question enough to get you where you want to go? Or I think I was Kelly as well. Did I kind of give you an idea of what I'm talking about as far as, and they're all here, by the way, there's more the CADCA has. What I do sometimes, I just go look up logic model and put in my topic subject, underage drinking CADCA. And sometimes they have stuff already for me and things that I can utilize as part of a starting point. So, and I know Detroit Love Coalition has done some stuff with CADCA as well as part of the End the Systemic, I think it's called, is one of the toolkits they did as well. And it's on the CADCA stuff as well, but I'll leave it open for any questions. We're about 5:15, so